Officials want to know, but predictions vary wildly, from now to after hundreds of millions of people are infected. Coronavirus infections in China continue to swell by thousands a day, prompting epidemiologists to estimate when the outbreak will peak. Some suggest the climax, when the number of new infections in a single day reaches its highest point, will happen any time now. Others say that it is months away and that the virus will infect millions, or in one estimate hundreds of millions, of people first. Public health officials want to know roughly when the peak will be, and how many will be infected, so that they can prepare hospitals and know when it will be safe to lift travel restrictions. Wuhan, the city at the center of the epidemic, and several other nearby cities have been on lockdown since late January. Although peak predictions can be illuminating, some researchers warn that accuracy is difficult to achieve, especially when the data used in models are incomplete. If you revise your predictions every week to say that the outbreak will peak in a week or two, eventually you will be correct, says Brian Labus, who works on disease surveillance at the University of Nevada, Las Vegas. Worst case. Some researchers find such predictions overly optimistic. People in most Chinese cities started returning to work last week after an extended public holiday period, opening up the possibility of new chains of transmission, says Hiroshi Nishira, an epidemiologist at Hokkaido University in Sapporo, Japan. Nishira says he has used a model that estimates that the outbreak will peak sometime between late March and late May. At this point, he says, up to 2–3 million cases will be diagnosed in a single day. In total, he estimates that between 550 million and 650 million people across China will be infected, roughly 40% of the country's population. Nishira says that about half of those people will show symptoms. Nishira says he has submitted a paper describing the model and its prediction to the preprint server medRxiv. To make such a prediction, he says that his team considered the transmission potential inherent to the new virus, the basic reproduction number known as R0, which is related to R, although it assumes that everyone in the population is susceptible to infection. The team estimates the R0 is between 1.5 and 2.